Dr. Marijunan, who will be presenting. So, with no further ado.
Well, we're at noon, so hi everybody, I'm Dr. Marijunan. Welcome. Are you guys enjoying this weekend so far?
Yes, we are.
It is. It's a memorable weekend. You know, we just celebrated 9/11 yesterday, so in remembrance of what's happening. And I'm very proud to be here. I've seen this NECAM conference totally blossom from the very first conference, and I too have had a wonderful journey with this. So the topic today is going to be your brain, your gut, your ECS, and cannabis. How many of you have heard about the endocannabinoid system? Wonderful. I love it. I didn't learn about this system, and many of my colleagues as healthcare providers did not learn about this and still continue not to know about it. So you guys are going to be my messengers today and take the knowledge that you learn. How many of you are from Massachusetts? Anybody from out of state? Where are you guys from?
Louisiana.
Where?
Louisiana.
Louisiana.
Oregon.
Oregon.
Idaho.
Idaho. Anywhere else?
Chicago.
Where's
Chicago.
Chicago? Wonderful. Welcome everybody. And how about you?
North Carolina.
No, I was just down in Raleigh, North Carolina at the Southern Hemp Expo, and it's really fascinating that we still have states that don't have a medical program yet. So a little bit about me. I am a medical doctor. I'm originally from India. I did my first life and did my medical school in Newark, New Jersey. I had been doing research there probably from the time I was about 10 years old and loving it. And I knew always that I wanted to be a physician. I also really got into family medicine, and that's where I did my first life in Charleston, South Carolina. I really understood the value of preventative health, and I pursued my second life in Massachusetts, and I did my residency in occupation and environmental medicine, which is a subspecialty of preventative medicine. In order to do that, I had to get a master's in public health. So from 1998 to 2003, I spent my time at Harvard, and I also did a fellowship in heavy metals. And you'll understand why I am so passionate about testing of my products and my plant known as cannabis that we're all learning about today. I'm also a medical review officer. If any of you ever peed in a cup and tested positive for this chemical known as THC, you might have gotten a call from one of me saying, why are you testing positive for this chemical or for your other prescription meds as well? Full circle, I'm also a diplomat in cannabinoid medicine. And originally when I started to say this, I wouldn't have said it with such pride because I would say I'm a family doc, and cannabinoid medicine. Now I say I'm a cannabinoid medicine physician, and yes, I'm a family doc and also an occupational medicine physician. Yes, yes, and I love it. Very proud of it. And as a diplomat in cannabinoid medicine, I take my practice very seriously, and I really believe that this is a specialty, and we will understand the value of it as a specialty. My background goes to, I'm a founder and CEO of Global Health and Hygiene Solutions, which was created in 2006 with a mission to promote wellness and prevent illness. That's always been my mission. I had no idea that cannabis was going to become a part of my world or my toolkit. In 2014, I created the clinic Uplifting Health and Wellness, and it's now in Cambridge, Massachusetts, with 3 words that we focus on, which is educate, embrace, empower. And that's what I really believe in, is the power of education. And that's been a two-way street for me. My patients have educated me, I've educated them, and they're able to share the knowledge. I embrace them by certifying them and giving that piece of paper by making them a legal patient. And we empower them. Earlier we had people mentioning about how they've used cannabis to get off of alcohol. Well, I call it the exit drug. Not the entrance drug, but the exit drug. And we're going to get to that later. So some registered trademarks. Cannabis, the exit drug, is my registered trademark. So when you folks see it out there, please remember where it came from, and please give credit for it. And I'm also, Dr. Uma says, what we in our society today, what we're seeing on a global level is that, believe it or not, our aging population is increasing and our younger population is decreasing, and we're going to see this happen throughout the world and as time goes by. What that means is that a lot more chronic illnesses. How does your gut have anything to do with all of this? I really believe your gut is really your brain. And I'm gonna repeat that. Your gut is your brain. What is she talking about? Well, guess what? Your gut has everything to do with our illnesses. And people are facing, no matter who you are, this word known as stress. Anybody here not know that word? Well, guess what? It's a part of your life. And how we cope with it is going to vary. And what we understand is that this affects every organism system, from autism, Parkinson's, Crohn's disease, ulcerative colitis, and look at all the things that we're seeing here. Not one thing is missed. Well, we've got our brain, which has functions. And your brain, folks, is made up of cholesterol. How many people know people that are on anti-cholesterol medication, statins? Well, I'm a little scared. I'm gonna say this, and this is being heard publicly and globally. Everybody that's on a statin will have some form of dementia. We're given statins to protect numbers. There's beyond numbers that we should be treating, which is the individual. Understanding that the brain has different functions. The parietal lobe, language. Occipital lobe, vision. Cerebellum, coordination. Your brainstem, heart rate, temperature control. Temporal lobe, hearing, emotions. Your frontal lobe, your thinking, your speaking, your whole brain has functions, and we're taking statins. And what are we gonna do to this brain? And where do these statins end up? We take a pill, and guess where it goes? Into your gut. And your gut is where we're seeing the impact. Everything, the bacteria, and we keep hearing about this thing called leaky gut. I got a leaky gut, I got a leaky gut. Well, yeah, because what we're realizing is there's this flora, a membrane, something that's supposed to protect us, and at the same time, it's a way of communicating with the brain. And there's cells, not just for absorption, but for communication with the nervous system. And this connection goes both ways. The vagus nerve is the pathway, the splenic pathway. These are what's connecting the cerebral cortex, the brainstem, our hypothalamus, with our nervous system, and in turn, with every function. Okay? What's also important is when this function is not talking to one another, what are the diseases that we get? And I want you to take apart the word disease. D-I-S. And I'm gonna just flip that word around today for you guys to understand. S is for stress. I is inflammation. And D is disease. So if you're facing stress and you've got inflammation, you have a potential for dis-ease. And as clinicians, we come up with fancy terms. Dermatitis, gastritis, appendicitis, PTS, anxiety, depression, and the list goes on and on and on. What we also understand is that if this gut bacteria is not at ease or with the amount of bacteria that it needs, it's called dysbiosis. It's not there. this connection is controlled by bacteria, fungus, parasites, everything, viruses, and we need that. We need them, folks. And yes, we're talking about COVID, and I'm gonna talk a little bit about that. Viruses are gonna be around, but what we understand is that there's metabolites that work with this, our bile acids, vitamins. We've got inflammatory markers. We've got all of these things that I mentioned, and what they do is they impact your heart, cardiac diseases, your liver, cancers, infections, your brain, Parkinson's, Alzheimer's, prostate, kidney, lung disease, allergies, and yes, obesity. What we're realizing is if we're not at ease, all of these diseases. What's happened in our world? Let's talk about that. 1 in 3 C-sections. So we're not coming out through the vagina, folks. So this has some pluses and minuses. Yes, we're avoiding certain things that, like syphilis, that where people had exposures that we don't have the complications, but the majority is we're not getting the exposures that we need. They're saying now even if you have a C-section, get the vaginal mucosa from the mother and rub that on the baby, so at least you're giving that introduction. We need that exposure. We're not holding our babies. We're not breastfeeding them anymore. We're giving them bottles. They're isolated from us. We're not together. They go to daycare. We're not getting what the mother's passing on. And generations of our bacteria are passed on. And we've eliminated that. And what we found is that children that are exposed to dirt and bacteria are more likely to survive because their immune system is able to fight things off versus when we're born with this hygienic environment. So all of this hand sanitizers that we see scares me. Why? Because it's alcohol based. It's breaking down the skin and the fat that's on our skin, folks. Wash your hands. Sing the happy birthday song. That's what you're supposed to do. We've forgotten the basics. So remember that, where your origination came from, what we were supposed to be exposed to, breastfeeding, all of these things naturally that we're supposed to. What we're understanding is this hygienic, non-self environment piece is impacting us, not just here, globally and locally. We've seen this with asthma, type 1 diabetes, celiac disease, obesity. These are all man-made diseases that we've created from messing with what we put in our gut and our environment. I want to touch upon pandemics, folks. This slide is very important because what's showing you is the number of deaths from COVID in comparison to all the other plagues that we've had. Take a real close look at this. Because what this is showing you is that viruses are going to be around, folks. And just keep on vaccinations and boosters and everything are not always the solutions. And I'm not against vaccines. I'm just explaining that we need to boost our immune system, and that's going to be from your gut. Let's get that straight, folks. From your gut, which will help you think and make decisions. Somehow we've lost that. So remember that and look at the numbers and understand that viruses mutate. And viruses is one of the things that really fascinates me. Because why is it that two people, partners, one has HIV and the other person never contracts it? One has hepatitis B or C and the other person never contracts it. One has herpes, never contracts it. One has AIDS, never contracts it. One has COVID, doesn't contract it. Let's think about this, folks, and understand viruses are going to mutate, so boost up your immune system as a community. So what we understand is that there's a system. known as my favorite system. I get excited about this. It's known as the endocannabinoid system. The endocannabinoid system, folks, is a mere 600 million years old. Yeah, so it's not something new. It's evolved from what we have in a sea squirt to what we have in humans today. And this system, we're learning more and more, very much analogous to the nervous system. The brain connection, what do you know? Well, this system is very much like dopamine and serotonin, which you guys have heard about, right? Dopamine and serotonin are neurotransmitters. Dopamine and serotonin are made in the presynaptic, they're released and they bind to the postsynaptic. What we understand is our body makes endocannabinoids, and they're very unique. They're not made in the pre, they're made in the postsynaptic, and they are released and the receptors are on the pre. So it's a retrograde mechanism. And what this mechanism is meant to do is to put you at ease. In the word of Dr. DiMaggio, it's meant for us to relax, eat, sleep, forget, and protect. Let's go through those words. So if your muscle is constantly twitching or you're seizing, you just don't move like an ALS. If you eat too much, obesity. If you don't eat enough, anorexia. If you sleep too much, depression. If you don't sleep enough, PTS. So it's equally important to forget, folks, as it is to remember. If your body overprotects autoimmune diseases, if it doesn't protect, you're immunocompromised. Dr. Uma explains this system in one word. Life. Life. And they didn't teach it to me. So this is why I do what I do. So we understand that there's receptors, CB1, which is primarily in the brain, CB2 primarily in the immune system, but these CB1 receptors are in our gut, and this is why cannabis works with this system. And what we understand is that it's a lock and key. CBD, the most intoxicating cannabinoid, THC is the most intoxicating cannabinoid. So non-intoxicating CBD and intoxicating THC. So I look at this as a spectrum. THC works with CB1 and CB2. CBD, folks, does not. It does not. It works with a different receptor known as TRPV. But this is why we want the whole plant. Please understand that. What we understand is that we've learned about not only CB1 and CB2, multiple receptors. We're learning about so many different cannabinoids. We've identified over 150 different cannabinoids. And I look at this plant in 4 forms. In the raw form, which is the acidic form, THCA, CBDA. I look at it in the dried form, which is still in those acidic forms. When it's heated, it converts from THCA to THC, from CBDA to CBD. And then in the aged form, CBN. All of these are different cannabinoids, and we're learning much, much more. How could this be? That a first drop of breast milk a baby receives has a molecule known as anandamide. And anandamide mimics my lovely molecule, THC. That's why it works so beautifully with a system known as the endocannabinoid system. And as you can see, when a baby suckles, it relaxes, it eats, it's able to rejuvenate, it's getting the protection. And it also forgets what it's been through. What we understand is this anandamide works directly with the receptors that are in the gut. That's why this whole concept, I said that remember? Inflammation. That inflammation is what stimulates this whole anandamide to get released. And sometimes we just can't produce enough anandamide. This is why I look at cannabis as a supplementation, a nutritional supplementation that we're treating a deficiency with. Okay? And what we understand is that it impacts inflammation in the bowel. This is where we talk about Crohn's disease, inflammatory bowel disease, ulcerative colitis, IBD, diarrhea, constipation, nausea, anxiety, depression, all of this related to the self. What we've understood is that cannabis has mechanisms. Why does this plant work? It's not because Dr. Uma says so. It's not because we want to just enjoy using this plant. There's a science. We know that cannabis is a bronchodilator. That's why it works for asthmatic patients, why it works for COPD, why it works for COVID, why it prevents people from the complications of it by consuming it. It's an antiemetic for nausea, vomiting. It's an appetite stimulation for our patients that can't eat. It's an analgesic for pain control, spasticity for my patients. And it decreases intraocular pressure. Our glaucoma patients that are saving their vision. You might have heard the rhetoric that we don't have research. Well, let's get the facts straight, folks. There's lots of research. There's a thing called Google, if you guys have forgotten. If you really would like to look for research as well, look for pubmed.gov, www.pubmed.gov. We understand that cannabis works, folks, and why it works so beautifully as a safe alternative. Our seniors have found it to be much more helpful. They prefer it. We know in the states where cannabis is available and the dispensaries are there, opioid reduction. We're facing an opioid epidemic, folks. If you have not been touched by this or know somebody that has not, over 90,000 people died last year, and the numbers are increasing. Well, let's tell you a little bit about where cannabis came from. Like I said, I'm originally from India. Ayurvedic medicine, Ayu means life, and Veda means knowledge. Cannabis is a sacred plant in my country, and it was used not only for medicinal purposes, but are part of our religion. And yes, I want you guys to understand what the word recreational means. It means to recreate oneself, okay? Not just understanding that it's just fun and joy. We are meant to recreate. I look at cannabis for two purposes. It's all medicinal, folks. It's all medicinal, and it's industrial purposes. That's what it's about. Call it what you want, but that's how I look at it. Doctors had the liberty to write a prescription. I can't do that today, folks. It's still federally illegal. I can make only a recommendation for cannabis. Did you know that cannabis was listed in the United States Pharmacopoeia? How many of you just learned that today? Thank you. Because you need to take these facts to your healthcare providers. You need to know the 3 facts that I want you to walk away with. Fact number 1, nobody in the whole world has ever died from cannabis. Nobody. You can't. Because the brain stem that controls our breathing can't be blocked. Respiratory depression doesn't stop your breathing, doesn't stop your heart. The fact is also that the government has a patent for this plant. Patent number 6630507, issued on October 7th. But doctors wrote this prescription for things like alcoholism. It was prescribed for alcoholism, gout, opioid addiction, for the treatment of insanity. And what we realize is this gut connection is why we're suffering with anxiety and depression and PTS and all of the mental health illnesses that we're struggling with. And this was in our pharmacopoeia. And companies like Park Davis, where my dad worked, made these drugs. There was tinctures. There was asthma cigarettes. Yeah. Asthma cigarettes. Guess what was in those cigarettes, folks? Say it loud. Say it again.
Cannabis.
Thank you. Yeah, cannabis was used as your bronchodilator. They lit it up and you inhaled it. And it got into the lungs, right into the bloodstream. quick onset, bronchodilated, vasodilated. It's an expectorant, folks. Yes, it's meant to make you cough. So if you don't cough, maybe you're not doing it right. But just to let you know, people say, yeah, Dr. O'May, it makes me cough. I'm like, yeah, it's working. Because it's supposed to bring up the phlegm. That's what it was used for tuberculosis. It prevents the cytokine storm that we've all heard about. Cytokine storm, cytokine storm. Anybody here not hear the word cytokine storm yet? Cytokine storm is what we've heard about, how people have been infected with the COVID virus and how people are literally dying because they can't breathe. And my patients, I say this boldly and proudly, we didn't lose one of my patients to COVID. And I really believe cannabis was the reason, because it's preventative health. My patients come to me for treatment, they've been with me for maintenance, and they understand why I speak about this for preventative health. Do you guys remember at the very beginning I said my passion brought me to Massachusetts for preventative health? Well, cannabis is part of my toolkit now. And again, cannabis is in Schedule 1, meaning that there's no medical use, lie, no medical research, lie, potential for abuse, lie. So I just want you guys to know the facts. And that's why I do what I do every day, everywhere, locally and globally. My mission is to change the stigma and for the world to know about the endocannabinoid system, and I do it through education. So I want to give you guys all a hand today for being here. So give yourself a hand. I just want to read this quote. In Lancet, when pure and administered carefully, cannabis, one of the most valuable medicines we possess. They knew this, folks. They've known about it. So please understand this value of this medicine. This is what they did. Beware, young and old people of all walks of life. This may be handed to you by a friendly stranger. It contains the killer drug, marijuana, a powerful narcotic in which lurks murder, insanity, death. Warning, dope peddlers are shrewd. They may put some of this drug in your tea or your cigarette. Reefer makes darkies think they're as good as white men. I wish I could show you what a small marijuana cigarette can do to one of our degenerative Spanish-speaking residents. That's why our problem is so great. Marijuana is the most violent drug in the history of mankind. All Mexicans are crazy. This stuff, marijuana, makes them crazy. I want to be crazy. Anybody else want to join us? Yeah. This is the kind of things that they said, and this is what's propaganded today, folks. So understand where we're coming from and where we're going. What was legal and mandated for you to grow in this country became, you went to jail for it. It was part of our medicine, and it was prescribed by doctors. It's political and it's greed that continues, and that still continues today. And that's what put marijuana into prohibition in 1937. It was considered the billion-dollar crop, folks. Yeah. Over 25,000 products were made. Henry Ford had actually made a car that was made and ran on the fuel. Imagine where our world would be had we not had the tyrants change it. Who were these tyrants? Well, cannabis is food, fuel, fiber, paper, and medicine. And we replaced it with the Hearst, the DuPonts, the Rockefellers, the Carnegies, and the Mellon, and the badass mouthpiece, Harry Anslinger. They had their agenda. Every part of this plant can be used, folks. There's not one part of this plant that cannot be used. And it replenishes. I call cannabis the global solution. Why? My pillars are, I want to see this plant legalized throughout the whole world. And I don't mean just legalization. I want to see this decriminalized to two different things that we're seeing. Just because we have it legal, we're still seeing the disproportionate people being impacted. I wanna see laboratory standards. We need standards, we need testing, we need to make sure that the product is clean. Does it have contaminations, heavy metals, does it have solvents in it? Does it have pesticides that could have bacteria, fungus, mold? We need to know. We need to have everybody be able to grow it in your backyard if you like. It's a plant, it's a weed. Homegrown should be available. There's a whole lot of products that can be made with this product. In education, we must change the stigma and we must know about the endocannabinoid system. It's for the health and wellness locally and globally. So I call it the 5 Ps. Cannabis is for people. It's for pets. It's for this planet. It's for peace globally. And it's for profit. And this profit is not just money, folks. It's your health and wellness. You got one body, one life. And I say cannabis is an entrance to a better quality of life. It's an exit from pharmaceuticals, narcotics, alcohol, and nicotine. And I want people to understand, reach one, teach 10. Sometimes I get to speak to one person and they become the fountain to teach 10 other people. Today we've got all of you and everybody that's out there listening to us today. Please share this information. Dr. Uma says, open your hearts. You don't need to use this medicine, but you know somebody that can benefit from it. Open your minds, because we all have an endocannabinoid system. This will open doors for better relationships, better communication, less stigma, and understand no matter who you are or where you are, we all are going to be born and we're all going to die one day. So let's live life. Yes. Yeah.
So the endocannabinoid system, a lot of Western medicine wants measurements, pancreas function, liver function, endocannabinoid function.
I love it. So you mentioned already we want numbers. So the numbers that I look at, I like when I created Global Health and Hygiene Solutions, the 5 numbers that I wanted everybody to know for health was your blood pressure, your height and weight, so you can calculate your BMI. You should know your waist to hip ratio for metabolic syndrome, apples and pears. I want everybody to know what their good and bad cholesterol is, and also what their A1C or glucose is. So these 5 numbers that I've talked about, one is for diabetes, one is for metabolic syndrome, one is for obesity, one is for hypertension, and then the other one is for hyperlipidemia. So numbers. We could look at all of these numbers and monitor them with your use of cannabis. How's your endocannabinoid system working? And what we also do is we look at A1C. I can show you my patients. Our youngest is 2 in my clinic, and my eldest is 98. So I truly get to practice family medicine. And I do look at their numbers. And what we've shown is my patients that were on insulin, I've gotten them off of their insulin. I've lowered their A1C. We've got them on metformin. We've lowered their metformin. We've lowered their weight. The ones that were anorexic, that could not even get to 90 pounds, I got them to 100 pounds. We've lost over 100 pounds in some of our patients. We've kept people alive. So those are the kind of numbers that we can look at. And for cancer markers, look at the tumor. They're alive. Look at that. So, did that answer your question?
It did, it was lovely, thank you.
So this is what I want people to understand. Don't get fooled anymore, folks. They're asking for double-blinded studies. Double-blinded studies is what got us to have opioids on the market, which are killing people. I want you guys to look at who you are. Look at your bodies. Let your doctors look at you. If they don't answer your question, next. It's your body. I can't stress upon this to everybody out there. And this body starts with what we're putting in here. Learn to read labels. My son has this thing, he says if it's got more than 5 ingredients, and if it's too long that you can't look it up, get to know what you're putting in. If it's processed food, your body has to process it. Synthetics is what's causing a lot of problems and our diseases. So just remember what I explained to you. Stress is gonna be there. Enjoy it. Breathe with it. Understand inflammation is what you're gonna prevent, because ultimately every inflammation has a fancy term. Itis, dermatitis, arthritis, gastritis, appendicitis, carditis, and there's some itis for everything. Any other questions? Yes.
Is there a difference between inhalation and ingestion and how that influences the ECS?
Let's talk about that. So, inhalation and ingestion. I look at this as the individual. I always say cannabis use is personalized. So, Dr. Uma tries to make things funny, okay? So I say, Dr. Uma says, do me. You can write this down. Do me. D stands for duration. O stands for onset. So when you look at onset and duration, inhalation is right here. It's a very quick onset, but it's short acting. Short acting. Because it goes through the lungs. You feel it in the bloodstream. That's why you have to keep inhaling. When you ingest it, it's a later onset and longer lasting. Why? Because it goes through this thing called your mouth, and it has to go through a digestive system, and in the liver, it gets converted from 9-delta THC to 11-hydroxy THC. So it lasts longer. So depending on what you need, you can use a combination. So for my patients that need to sleep, sleep is crucial, folks. Sleep, circadian rhythm causes inflammation. If you don't sleep properly, it causes a lot of inflammation. So when you use a combination of a little inhalation and a little ingestion, you can sleep for a duration. So depending on what your condition is and what you need to treat, you will use combinations. I just want to follow that up by giving you some more information. Dr. Donald Tashkin, you can write this name down, Tashkin. Dr. Donald Tashkin is a pulmonologist at UCLA, and they looked at 4 groups of people. People that smoked nothing, people that smoked cannabis, people that smoked tobacco, and people that did both tobacco and cannabis. Lo and behold, guess which group had the least amount of cancers, folks?
Just smoke cannabis.
Say it loud again. Yes. Cannabis is the preventative health, and what they found is that less lung cancer in patients that smoke cannabis. So they didn't believe that. So they said, okay, let's look at the other 2 groups, people that smoke tobacco and cannabis. And lo and behold, people that had the cannabis on board with the tobacco had less lung cancer than people that smoked tobacco alone. Again, protection. Ultimately, I'm getting my patients off of the nicotine as well. So understanding that the tobacco that you're smoking today is not the tobacco that your grandpa or your great-grandpa smoked. They have so many chemicals in it now. So this is what understanding what's in your product. Did I answer your question?
Yes, thank you.
So,
Your acronym, do me,
I'm sorry?
duration, onset.
And the me. So the me is all about each of you. So what I say is the me stands for at this moment, what effects do I need is what you're going to be asking yourself. And remember the 3 modes. You're going to say, okay, I know I have to treat certain things. How can I maintain and how can I prevent? So do me, Dr. Uma says, duration, onset, at this moment, what effects do I need and how do I prevent things from happening? Okay.
Question, yeah. Something I found interesting recently is the presence of other compounds in the cannabis that
interact with the endocannabinoid system, like for example, beta-caryophyllene, the most prominent sesoterpene, and how it interacts with the CB2 receptor. And I wanted to ask you what you think is the purpose, the potential of compounds like
Oh,
this,
you
and if
get
there
me,
are
I
more
get
to
you,
that.
see how I'm getting, so I tell people, look, smell your weed. Nose, cranial nerve 1, olfaction, okay? So the lovely plant, I could talk about this for hours, but I'm glad you brought that up. The lovely plant, this cannabis plant, has cannabinoids, it has terpenoids, it has flavonoids. So the flavonoids is what gives it the beautiful colors. The terpenes is what gives it the aroma. So I tell people, smell the weed. Don't look at the label sometimes. Just sniff and see what makes you happy. And if the smell makes you happy, go to it. Then read the label and see what's on that profile. Because that's where I really believe with post-traumatic stress patients, we're all suffering from it. And I dropped the D, folks. I ain't no disease and I ain't no disorder. So let's call it PTS from now on, okay? Post-traumatic stress. And that's where you'll see that people that have PTS have a higher number of receptors. And why we can use cannabinoids. And I see my patients, that, especially my veterans or anybody for that fact, but mainly our veterans, because they don't know what the trigger is going to be. It could be a sound, it could be a sight, it could be a situation, it could be whatever. So this is where I tell people, try to smell things, kind of look at the profiles and then look at the terpenes that go along with it and try different things along those lines. And that's why Dr. Uma has 3 rules, folks. Rule number 1. Anybody know Dr. Uma's rule number 1? Tell me. Hydrate, yes. Hydrate before you medicate. Rule number 1, Dr. Uma says this because cannabis is it's going to dry you out. And most people are dried out anyway, to begin with. All right, and then you this is true. You know, I don't want to say, well, you know, Joe was a nice, supple, succulent, juicy piece of meat and we dehydrated him and we made him into Joe Jerky. That's what people are walking around. We're dehydrated. And people get anxious because we're dehydrated. So understand rule number 1 is hydrate before you medicate. Rule number 2, cannabis causes your blood sugar to drop and that can make you a little anxious, a little scary. So make sure you got food on board. And rule number 3, if you guys have any questions, I'm always here. Question?
I want, I just recently heard about cannabis hyperemesis syndrome.
I'm so glad you brought that up. Cannabis hyperemesis syndrome. Let's take this all apart, right? So they're saying cannabis, hyper means increased, emesis means puking your brains out, puking, and syndrome means that there's other things that come along with it. So this is where I call it the U of cannabis, okay? Just as much as cannabis treats certain things, it can cause certain things. I'm going to say that again. Just as much as it treats certain things, it can cause certain things. So just as much as it treats anxiety, it can cause anxiety. Just as much as it treats nausea, it can cause the nausea. So understand where that balance is for you folks, because that's where it comes into complication. Now, having said that, I'm tired of people being treated wrong because they test positive for THC and they blame it all on the cannabis. Stop it now. Because many people are suffering with mitochondrial disease that has been undiagnosed. Mitochondrial diseases can cause hyperemesis, and what happens is it's cyclic. So it's a build up and then it happens again. It's a build up and it happens again. I had a patient, 2.5 years, he kept going to the ER and they kept saying, you test positive for THC, stop smoking your weed. Stop smoking your weed. He's like, I haven't been smoking my weed. And this is what's causing the problem. And sometimes the only thing that helps me is the cannabis for the nausea. So this is where, finally, I called up the GI doctor. I said, do not discharge this man from the ER again. Work him up. And sure enough, he had a mitochondrial issue. But there's contamination. Remember what I said I studied my fellowship in, folks? Heavy metals. This is why I'm so passionate about don't mess with my plant. Don't contaminate my plant. My plant is a beautiful absorbing plant. So if you put lead and heavy metals either in the soil, in the air, or the water, the plant is going to suck it up. And then we concentrate it, and then we contaminate it. Again, concentration of the chemicals is what's killing people right now, and it's not the cannabis, it's the contaminations in it. And why I'm asking everybody, please understand your soil, the soil that we're contaminating all over the world. Understand what we're doing to it. Understand the air that we're breathing in, what we're doing to it. And the water, the source of your water, because that's what this plant is getting. Neem oil sprayed on these plants, concentrated, was not meant to be smoked. So again, understand what we're doing to this plant. And why I'm asking everybody, look at the ingredients. Make sure it's not just with the cannabis, in anything that you guys are dealing with. What you put in you, what you put on you and around you matters. It gets absorbed, and your skin is the largest organ system. I'm very passionate about this because I lost my mom to idiopathic pulmonary fibrosis, January 7, 2012. And I started to learn about this plant 2 years before she died, and I kept my mouth shut. And after she died, I decided to be a blabbermouth because it could have saved her life, and it could save many people's lives today. And I say cannabis cares. And what it stands for is that C, it must be a choice. A, it's a safe alternative. R, the research is out there. E, the endocannabinoid system lives within all of us. And S, it's a solution. It's a global solution. So understand and learn. Yes, ma'am.
So yesterday, there was another medical session where we were talking about psychedelics and helping with neuroplasticity of the brain. My question to that clinician, I want to put it to you, do you think that cannabis helps with neuroplasticity and is a solution to some of the mental wellness challenges?
I'm glad you brought that up. So cannabis is a psychotropic drug. Okay, that's why I do what I do. I would never, ever give a diagnosis of somebody to say, you have diabetes, here's your insulin, see you in a year. Okay, that's what people are doing with the cards right now,
Yeah.
and I take offense to that.
Yes.
I follow my patients.
Yes.
I take this very seriously. And yes, this is why people that can take cannabis for the first time can get totally freaked out, and I've seen this happen.
Yeah.
Okay? And where people say, it does nothing to me. And my patients, I'm in Cambridge, I'm very much interested in psychedelics, and my patients are using it. And we're actually planning to do another support group. I do monthly support groups, and we're looking at psychedelics and how patients are incorporating this as a tool. It's not for everybody. I make this blatant disclaimer. Cannabis is not for everybody. Yet it should be a first-line option, not the last resort. Same with psychedelics. There's so much we've known about it. They've suppressed the information. Harvard did a lot of work right here. A lot of work has been done here in Massachusetts. You gotta learn the 3 words, folks. Educate, embrace, and empower. I keep repeating this to you guys. It's about you. So learn about the different options. And yes, I really believe that there's neuroplasticity. So this is why when you keep hearing the rhetoric, the developing brain, the developing brain. Well, guess what? Your brain is developing till the day you die. We are learning. It's still developing. And it can be destroyed with these digonstatins. I'm very concerned, folks, about the medications that we're giving our people. As a primary care physician, I called it the party pack of 5. And I wrote these prescriptions day in and day out. Blood pressure, diabetes, cholesterol, something for reflux, something for anxiety or depression. These are the prescriptions that people have on their med list day in and day out, and there is no exit plan. None. You're started on the pill, 30 years later, you're on a higher dose. There is no exit plan. That's why I call cannabis the exit drug. It is an exit plan. Yes, sir.
So, you talked a lot, you talked about how important the gut, its health is. And I'm wondering if you have any recommendations other than, just general, cannabis usage, or if you have like a recommendation of the best way to help the gut, through cannabis.
Absolutely. So other than just understanding that there's an endocannabinoid system, because cannabinoids come from different places as well. What comes from our own body, phytocannabinoids and synthetic. But what we want people to understand is that hemp is a food source, okay? Anybody here tried hemp hearts yet? I love it. So this is a food source. Looking at your nutritional things as far as simple things that you can add is a little bit of fermented foods. Sauerkraut, adding a tablespoon of sauerkraut, a teaspoon, start with a teaspoon. A little bit of yogurt. Tryptophan, warm milk. Tryptophan gets converted into serotonin. Helps you. Remember that serotonin that everybody's on, SSRIs. So looking at the foods, you mentioned flavonoids and terpenoids. These are the other ways that we can also boost up our gut system. So looking at all of the different facets of what you're consuming is what's important.
Thank you.
So looking at the labels, I really want people to understand to read labels and look at the source of whatever it is. Today's goal was that to understand that your gut is your brain, and that there's an endocannabinoid system. And this endocannabinoid system has been messed with because of our society, because of so many synthetic molecules that we've been exposed to since 1937 when Prohibition happened. Since 1950, autoimmune diseases have increased, and they continue to increase. Cancers continue to increase. And I really believe it's because of the elimination of hemp. If our animals were fed hemp, they would not be inflamed. The products that came from them would not be inflamed. When we consume the egg or the bacon or the chicken, we're not getting inflamed. So that's why I say it's for people, for pets, for the planet, for peace, and for profit. Any other questions? Yes, sir.
I have one. We're talking about gut health and the microbiome. Do you prescribe or what do you do for people to get better consortium of microbes in their stomach? Do you, just yogurt or probiotics or
Well, the things I tell people.
good one from,
Yeah, and this is where I tell people to first of all eliminate anything carbonated in their diet. Nothing carbonated, nothing diet, nothing decaf, nothing low fat, nothing fat free. These are the 5 things I tell people to eliminate. Why? Carbonation leaches calcium, magnesium, and zinc out of your body. They forget to tell you that. Anything diet or decaf means that there's a process. Anything low fat or fat free, process. And you need the fat in your gut. We're taking the fat away and I'm really concerned about it. So those are the things that I tell people to kind of avoid. And then again, make sure you're replenishing this. Again, fruits, fiber, and this is where I love my hemp hearts. 1 serving of hemp hearts gives you 3 tablespoons, 10 grams of protein, 180 calories, 21 amino acids, 9 of them are essential, 12 omega-3, omega-6s. So what I'm saying is, as we get older, look for the bang for your buck and where the source of the things of the foods that you're getting. Ask where it came from.
how much fiber is in a serving of those hearts? Because that gets, I'm the diabetic, so I deduct the fiber.
I'm not sure, I know off the top of my head, I would have to look at the label, but definitely look at it. Wonderful on the glycemic index.
Hi, yes, so earlier we were talking about the process of breastfeeding. I've known a lot of people who have used cannabis to treat their symptoms through their pregnancy, but then are concerned about giving that THC to their children, and I was wondering if you think there was any concern.
Wonderful question. So, there was a study done in Jamaica, and they looked at the Rastafarian community and how the impact was the children being breastfed and everything else, and even they make the tea. What we found is that the children are more socially and emotionally balanced. What a concept. Okay, so, this is where, you know, there's a lot of stigma. And I have a bunch of canna babies, many women and men that were told that they can't have children. I'm proud. I'm their doctor for these canna babies. So definitely look up the information, and there's lots of research that has been done, and more research needs to be done. But remember, breast milk, anandamide, mimics THC. All right, guys, thank you so much.